Hello, Mr. Quill. My name is Eric Newton. I'm the pharmacist here on duty. If you have, I have a few minutes of your time today, I'd like to ask you a couple questions about your current medications. It would only take about 15 minutes, and it'll help me identify some of the issues with your current drug therapy. This can ensure that you're getting the maximum benefits from all your medications. And if you have any questions or concerns throughout the interview, please feel free to ask me, okay?
Yeah, I think I have some time today. That sounds great.
Great. Now, before we get into things, I see here on a chart that you have a penicillin allergy.
Yes.
What other allergies do you have that are not listed?
None. That's the only one I have.
All right. So I see here you're taking about 20 milligrams of lisinopril once daily. Is that correct?
That's correct.
What did your doctor tell you about this medication?
Well, 3 months ago, my doctor told me I have high blood pressure.
Okay.
He said I should take 1 tablet every morning with breakfast.
Okay. Have you experienced any side effects or anything that is unusual while you took this medication?
I haven't noticed anything at this time.
How do you typically take it? Do you miss some days or during the week, or like how is everything going?
I usually take 1 tablet in the morning with my breakfast, but I feel fine, so sometimes I forget.
Okay.
I think I missed about 2 doses.
I
This
understand.
week.
Okay, I kind of understand with the condition like hypertension, you may overlook some of the seriousness, but perhaps I can offer you some additional like pamphlets on hypertension to help you like fully understand your disease state, because we want to make sure that you're getting just like the best out of this drug therapy. Okay?
That would be very helpful. Thank you.
What also has your doctor said about the way that you're taking your medication? Is there anything else that told you?
I don't tell my doctor because I don't want him to get mad. At my last visit, he told me the medication is not really working, so he added another medication.
Okay. And what medication would that be that he told you about?
Hydro something, HCC, I think.
Is it hydrochlorothiazide? Is like HTC?
Yes, that's it.
Okay, just make sure. Let's see. And then what information did he tell you about the HCTZ? Like,
My doctor told me I should take 1 tablet every morning with the lisinopril,
okay.
and that this medication will make me pee a lot.
Okay, it's understandable. Have you, how have you been feeling about taking the medication? Like, is it working? Like, is it?
I take it in the morning with my other medication when I remember.
Okay. And have you been experiencing any side effects with this one? Like anything out of the ordinary when like this is not normal?
Besides the fact I have been going pee a lot more, nothing out of the usual.
Okay. And how are you currently monitoring the blood pressure?
I try to check my blood pressure when I pick up my medications, and when I go see my doctors, he checks it. Last time he told me it was 145 over 90, and when I checked today, it was 160 over 90.
I can understand it can be difficult to remember to take your blood pressure meds while you're out, but have you ever considered taking like a blood pressure monitor like to check at home?
It would be more convenient for me to check at home, having it sitting out and remembering to check.
Okay.
I do not know the best one to use though.
Okay, that makes sense. After we're done talking here about your medication and your health concerns, I can walk you up to some of the monitors, and then we can recommend some easy ones to use and some reliable blood pressure machines, if that's okay.
Okay, perfect. I need to start being on top of this. 2 years ago, my brother died of a stroke, and I'm worried that I am traveling down the same path as him.
Okay. Well, I'm definitely sorry for your loss of your brother. This condition, what could happen, it can be scary, but this is where we need to kind of work together as a team, me and you working together. And if you continue taking medication as directed, and we just manage a nice, healthy lifestyle, get you out working out and stuff like that, and you just keep your open communication between me and you, it doesn't have to be that scary. We're here for you, and we're here to help.
I appreciate the time and thank you for making this a better experience.
No problem. I'll always be here as long as you need me. Now, stepping away from your medications, do you take any over-the-counter medications at all?
I take Tylenol 500 milligram. I get occasional headaches from work stress.
Does Dr. Thanos know that you're taking this medication?
Yes, I mentioned it to him before that I get this occasional headache, and he was the one who suggested me to take this medication, so it wouldn't interfere with my rest of my medications.
It just depends. First, I just like to ask, when do you get these occasional headaches, and how do you usually take the medication?
Well, I take one every 5 hours or so.
Okay. And how long have you been taking the Tylenol?
On and off for about 2 months or so. Whenever I get occasional work stress headache, this definitely has saved me though, and has worked very well for me, with no side effects like the other medications.
Okay. All right, as long as it's working for you and you haven't experienced any real issues with it, if your headaches increase over time and you see yourself taking more Tylenol, make sure to be just open communication with the doctor. We want to make sure that it's not really just having any other problems or interactions with you. okay?
Okay, gotcha.
All right, Mr. Quill, the next session I'm going to ask you about some personal questions, if this is okay. Just remember, what we discuss in this room is just between me and you, so I'm not going to go out until this is all confidential, and I just want to make sure that we're getting the most out of the medication therapy, okay?
Okay, well, let's dive right into it.
Okay, how much tobacco, if any, do you consume on a daily basis?
I'm not a smoker or a tobacco user.
Okay, and what about alcohol use? How much do you drink, if any?
This is where my downfall is. I'm kind of a binge drinker. Every other weekend I get together with friends for some sports parties and we get plastered. I usually lose count around 15, I would say.
Okay.
I know it's not good for me, but I like to enjoy the game with my friends.
Okay. I appreciate you being upfront with me. I feel that you've come to the conclusion that this might be a slight problem, just a little bit. Maybe suggest to your friends other places that you don't have to drink as much alcohol and stay away from binge drinking. Like, take baby steps, kind of cut down on some of the drinking, and then it can definitely go a long way to help you maintain your condition.
I know it will be hard to do, but for my health, it'll be worth it. I can definitely cut down the amount of drinks I consume and can suggest other meeting places to still have fun.
Okay, that makes sense. Now to the next question. I need to ask for all my patients. I'm trying to exclude anyone, if any. If any, do you use any like illegal substances or drugs?
Absolutely not. Drinking is my vice. By illegal drugs, I stay clear.
Okay. And fantastic. Thank you for being upfront with me about that. You said you also have some work stress. What do you do for a living exactly?
I'm an accountant for a large company.
Oh, so I wonder why you experience headaches from time to time. It kind of makes sense. But in that environment, how much caffeine do you usually drink?
And I would say I drink a cup of coffee a day.
Okay, so that's not too bad. This is a manageable amount. It's also easy to keep the lifestyle pretty balanced. So, like, how's your diet with that?
My doctor has talked about my diet on a couple of occasions. I have been staying away from a lot of fatty foods,
Okay.
and I have cut back from going out to eat. I sure do miss my burgers, though.
Okay, that's definitely understandable. Even for me, it's hard to stay away from those fatty foods. But you're also doing a great job at it. Keeping a close eye on the amount of foods that you eat, and just in the long run, it helps out. It's a good lifestyle choice, and it also helps with like if you do a little bit of exercise. Like, how often do you exercise?
Well, I run on the treadmill for an hour a day, usually 4 to 5 times a week.
Okay, so for what I'm telling you, you're putting in pretty good practices when it comes to exercises. Like, you're definitely getting out there. Like we discussed, try to cut back on the drinking and continue to do like the great work on your diet because you're definitely trying and you're making that effort. You also pointed out you skipped a few doses of your medications. Maybe I should suggest getting like a pill box. We do have those in the pharmacy if you wanted to. I can also show you those when I show you the blood pressure monitor. And just continue to take your medications prescribed because it'll definitely help control your blood pressure. Other than the last few steps to work on, any other health conditions, are there any other things I should be aware of?
No, there are no other health conditions at this time. I think this is a great idea for a pill box along with getting a blood pressure monitor to help me get my health in order. I appreciate you talking to me and listening and giving me steps that are realistic for me to put in place.
This is no problem, Mr. Quill. If you would like, the next time you come in to pick up your medication, we can schedule a talk to just, like we did today, just keep up with your progress. I want to have constant updates on everything.
That sounds like a good idea.
Okay, if there are no other concerns or like questions that you have for me, I can show you a couple of the monitors that would be good to help check your blood pressure.
That's fine.